Borderline personality disorder, or BPD, is a complex mental health condition. It's characterized by intense emotions, unstable relationships, and a distorted self-image. But what does that really mean for someone living with BPD? Let's dive into a story to help you understand. Today, we will learn about what borderline personality disorder is through an interesting story of a girl named Sarah. She is a teacher in her late 20s who loves to draw, paint, and listen to music, like any other girl. Yet inside, she wages a daily private war against something beyond her control. That is because Sarah has borderline personality disorder, or BPD. Through Sarah's story, I'll help you understand what BPD feels like, what causes it, how it's treated, and how you can support someone who has it. The story of Sarah. Sarah wakes up every morning insecure. One moment she is full of energy and excited about her life, while the next she wonders if something is missing inside of her. It's hard for her when it comes to relationships. Sarah loves her friends and family, but she is fearful they will leave her. Sometimes that gets so strong that the anger pushes people away, or the sudden decisions to cut them off. She doesn't want to hurt them, and she doesn't know how to stop. If Sarah feels too much, she will act without thinking. She may overspend money that she doesn't have, overeat, or even hurt herself. These acts themselves make her feel even worse, but at the moment, she will try just about anything in order to get away from such excruciating pain. One day, after an enormous fight with her best friend, Sarah seeks to get help. She visits a therapist who listens to her story and explains that she has borderline personality disorder. What is BPD? BPD is a mental disorder that affects a person's thinking, feelings, and behavior. It's like being on an emotional roller coaster that never seems to stop. A person must present at least 5 of the following signs according to the DSM-5 guide used by mental health professionals for them to be diagnosed with BPD. Fear of being abandoned. Unstable relationships that veer between loving a person and pushing them away. Not knowing who they really are or what they want. Acting on impulse, such as spending too much money or engaging in risky behavior. Harming themselves or considering suicide. Mood swings that are extreme. Always feeling empty inside. Intense anger that's hard to control. Feeling paranoid or detached when experiencing stress. Several of these signs are met by Sarah, hence her therapist diagnosed her with BPD. What causes BPD? BPD does not happen because a person is weak or bad. It is the result of various factors coming together, such as brain differences. The parts of the brain that govern emotions and decisions may work differently in people with BPD. Family history. If someone in your family has a mental health condition, your chances of having BPD are higher. Childhood experiences. Individuals who have experienced trauma, neglect, or unstable relationships in childhood are more likely to develop BPD. It was her therapist who pointed out that her abandonment fears and strong affects could be partially due to the emotional neglect she experienced in childhood. Treatment options for BPD. BPD is challenging, but it is treatable. Sarah's journey to healing started with a mix of therapies and tools designed to help her feel more in control. Dialectical behavior therapy, or DBT, is the gold standard. DBT was created specifically for people with BPD. It focuses on teaching 4 key skills: mindfulness, learning to stay present and calm even when emotions are overwhelming. For Sarah, this helped her stop reacting impulsively. Emotion regulation, teaching Sarah ways to manage her intense emotions, like anger or sadness, so they wouldn't take over her life. Distress, tolerance, helping Sarah learn how to get through painful situations without harming herself or making things worse. Interpersonal effectiveness, showing Sarah how to communicate better, build stronger relationships, and set healthy boundaries. DBT is often done in weekly individual therapy and group skills training, giving Sarah both personal support and a sense of community. Next, cognitive behavioral therapy, or CBT, helps people identify and challenge negative thought patterns that influence their feelings and behaviors. Sarah worked with her therapist to recognize when she was thinking in black and white terms, like everyone will leave me or I can't trust anyone. Over time, she learned to think in more balanced and realistic ways, which helped reduce her fear of abandonment. Schema therapy focuses on addressing long-term patterns and beliefs that started in childhood. Sarah explored her fear of being unlovable and worked on healing those deep wounds. This therapy helped her build a stronger sense of self and feel more secure in relationships. Medication can also support the process. While there isn't a specific medication for BPD, Sarah's psychiatrist prescribed antidepressants to help stabilize her mood and reduce her anxiety. For some people, mood stabilizers or antipsychotic medications can also be helpful, depending on their symptoms. Group therapy provided Sarah with a community. She joined a support group for people with BPD. Hearing others share their struggles and successes made her feel less alone. It also gave her a chance to practice her new skills in a safe space. Self-help and lifestyle changes played a crucial role as well. Sarah learned to take care of herself in simple ways, like journaling her emotions to understand them better, practicing mindfulness meditation to stay grounded, exercising regularly, which improved her mood, building a routine to feel more stable and in control. How to support someone with borderline personality disorder or BPD. Supporting a person with BPD can be challenging, but patience, understanding, and care go a long way. Here's how you can make a difference. First, be patient and understanding. People with BPD often feel misunderstood, so empathy is crucial. For example, if your friend Sarah calls late at night, crying because she feels uncared for, avoid saying, "You're overreacting." Instead, try, "I'm sorry you're feeling this way right now. I care about you and am here to listen." This validates her emotions without judgment, making her feel supported. Set healthy boundaries. While support is important, protecting your emotional well-being is essential. Clear boundaries promote stability in relationships. For example, if your sibling with BPD frequently demands attention during work hours, respond gently. "I care about you, but I can't talk during work. Let's catch up later this evening." This communicates your availability while respecting your limits. I made a separate video on how to set healthy boundaries, so be sure to check it out. Encourage treatment. Treatment, especially therapy, is one of the most effective ways to manage BPD, though it may seem intimidating to them. For example, if your partner resists therapy, saying it won't help, you could respond, "I know this feels overwhelming, but therapy can provide tools for managing tough moments. I can help you find a therapist, or even go with you for support." Offering practical assistance shows you care without pressuring them. Avoid taking it personally. BPD can result in intense emotional reactions or withdrawal due to fear of abandonment. It's vital to recognize that their behavior isn't about you. For example, if a friend cancels plans, saying they think you don't like them, respond calmly, "I'm sorry you feel that way. I enjoy spending time with you and hope we can reschedule." This reassures them without escalating the situation. Validate their feelings. Acknowledging their emotions can help them feel understood, as people with BPD often feel invalidated. For example, if a coworker says they feel like a failure due to a mistake, avoid saying, "It's not a big deal." Instead, say, "I understand why you're upset. It's hard to feel like you've let someone down, but we all make mistakes. It doesn't define you." Validation helps them feel heard and supported. Offer practical support. Small, thoughtful actions can make a significant difference. For example, if your friend feels overwhelmed and struggles with daily tasks, suggest, "Let's go grocery shopping together, and I'll help you plan meals for the week." This shows you care and alleviates their stress. Be consistent and reliable. Fear of abandonment is common in BPD, so dependability fosters trust. For example, if you promise to call at 7 p.m., follow through. If something prevents you, explain and reschedule. "I'm so sorry I can't call tonight, but I'd love to talk tomorrow at the same time." This consistency reassures them of your commitment. Educate yourself about BPD. Learning about BPD helps you respond with compassion and avoid frustration. For example, if you learn that impulsivity is a common symptom, you can calmly address reckless spending by saying, "I noticed you've been shopping a lot lately. Is everything okay? Would you like to talk about it?" Knowledge allows you to be supportive without judgment. Encourage healthy coping strategies. Suggesting constructive activities can help them manage emotions. For example, If your partner feels overwhelmed after a family argument, propose, "Why don't we take a walk to clear our heads?" It might help us both feel calmer. This shifts their focus to something positive and soothing. And finally, take care of yourself. Supporting someone with BPD can be draining, so self-care is crucial. For example, if you're feeling overwhelmed, let them know, "I care about you, but I'm feeling a bit drained. I need a day to recharge, and we can talk again tomorrow." This ensures you stay healthy while maintaining the relationship. If you found this video helpful, be sure to like, subscribe, and share with someone to break the stigma surrounding mental health.